the character Lilo, and it's a case study in the adjustment of disorder. Okay, first I have the character description. And who is Lilo? Lilo is the girl from Lilo and Stitch. She's a 6-year-old Hawaiian girl. She's emotionally sensitive, imaginative. She loves Elvis Presley, and she struggles socially. The setting and the cultural context is, well, the setting of the movie is in Hawaii. Strong emphasis on ohana, which is a phrase that they always repeat on the movie, that means family, community, and identity. Here we have the slide of the diagnosis, and the diagnosis is the adjustment disorder with mixed disturbance of emotions and conduct, defined by emotional or behavioral symptoms in response to stressors. Symptoms occur within 3 months of stressor. Example, loss of parents, fear of being taken from nanny, which is her oldest sister. The cultural considerations, in Hawaii, the culture therapy might not be the first line of response. Extended family of elders often offer support. Would a Hawaiian therapist diagnose her the same way? Possibly, but might also explore spiritual or familial healing first, which is, well, can also be the same as the rituals or the cultures that they have over there. This is the other side of the diagnosis, and here we have the stigma and cultural diagnosis, which mental health can be stigmatized, especially in collectivism or non-Western cultures. Kids may be labeled as bad instead of distressed. And here I have the cultural impact on diagnosis, which is Hawaiian values of ohana, which I told you before means family, may delay seeking therapy. And cultural context affects how Lilo symptoms are perceived. And here's a citation where I found this information. Next, we have some things of evidence that I saw also in the movie. The first one is when Lilo lies on the floor listening to sad music, and she prefers to isolate from peers. This can also be reflected as behavioral disturbance. And then we have another example that she fights at school, lashes out when others misunderstand her, and other problems that are a little bit funny, but at the same time can be an alert as someone that is seeing it as from another perspective. Then we have a symptom not clearly present is severe risk taking of suicidal ideation not shown. And the emotional symptoms, as I mentioned before, the isolation, and when she fights with her peers or her friends. And here are the citations of both things that happened at the movie. Then we have the treatment plan. Proposed treatment could be that child-centered play therapy. Here's the citation, and then the effective for processing trauma in young children. And why I think it fits, because it's age appropriate, and it also addresses both her emotional needs and sibling dynamics. According to Ray and Colliagles, This approach is especially effective for children like Lilo, who may not express their feelings directly. And I feel, well, in my opinion, I feel that Lilo doesn't express her feelings that well with her sister because she never had the opportunity to express them with her parents, uh, which she most probably will feel a little bit more comfortable in some situations. Here we have the second part of the treatment plan, the ethnical concerns, informed consent, which is a child plus the guardian, sensitive to family laws, avoiding labeling Lilo as bad, barriers to treatment, limited access to therapy in rural areas like Hawaii, financial struggles could be another important factor because Nani is unemployed and is her sister, and it's the only income she will receive from money. We have that cultural reluctance to seek outside help. Here is this slide, the broader perspective, and is this portrayal accurate? Yes, Lilo shows real signs of grief, misbehavior tied to emotional pain. It is subtle but meaningful. Disney does not name her condition, but the signs are there. The media and mental health understanding, films like Lilo and Stitch help normalize childhood trauma, which is not great, and encourages sympathy as viewers see Lilo as misunderstood, not crazy. Media can shape how people view therapy and children's emotional struggles. Here is my last slide of references, and that's all. I did choose this movie because it's my favorite one, and I'm very excited because on May it's coming out the live action movie. So I am looking forward to seeing it soon. But thank you.